Thank you for the opportunity again. So, eye behind the eye. Thanks to the whole Arvind Eye Care system, I'm Dr. Prasanna Venkatesh. I expected Venkatesh sir to be here. I had the first slide made for him, but anyway, I shared it to him on DM. So, thank you, Prabhu. Thank you, Venkatesh sir, and the whole Arvind Eye Care system. And this is just one of the methods that I am using in my day-to-day practice of how I edit my images. It is not the only method, and I just thought I should be very candid about this presentation when it was given to me on how you use tools to enhance your images, or how you go about artificial intelligence in editing your images. Before I just move into the real world scenario of how I do it, so this was one technique I learned from my good friend Dr. John. So when I started my practice, I always wanted to collect anterior segment pictures, and he told me just use a 700 rupee elephant boat adapter and just connect it on the slit lamp, and you can actually start visualizing the anterior segment. So this, as a postgraduate or as a neophyte in fellowship, gives you a lot of leverage to collect your own images. So all, as you can see here, all you need is just a single adapter here, a smartphone, which you can start your journey into imaging, right? Because we don't get access to anterior segment imaging as good as we get access to the posterior segment imaging. So what this journey led to is, I even ended up recording my own YAG PA video. How many of you have recorded your YAG PA here? Ophthalmologists, YAG PA. How many are ophthalmologists here? So I can see a lot of ophthalmologists here, right? How many of you have recorded your YAG PA? YAG PA is a very, I can see one person, madam is lifting. Anybody else? Right? This is a very simple procedure. We all know it. This was recorded in an iPhone with an elephant boat adapter for anterior segment imaging. One of my own patients where we ended up publishing. You can see the beautiful mesh of aqueous flowing out soon after the laser spot is being given. And this is done with the Abraham lens. And you can also see the demonstration of the Van Eriks soon after the procedure is done. Again, this is another video where I have used a slow motion setting, and soon after the laser spot is given, see the bluish red flame that comes out of the photo disruption that you get in YAG PA. This was the first, one of the first few videos in literature where we ended up, getting the photo disruption documented on human eye. You can see the bluish red flame. So this is how my journey started in ophthalmology in imaging, where anterior segment, we started using a lot of image-based module of teaching, or rather for me to document my own cases in anterior segment, a YAG cap or a fibrin membrane that I used to release by putting the laser, anything that you do, PCO or whatnot. So right, why images we are talking here today is ophthalmology is an imaging-based field. So since it's an imaging-based field, to always build your narrative, you need to tell a story. And there comes the brightness, the saturation, the color contrast, and the definition. Because that is where we really pitch ourselves. Even if you are going to do a simple gonioscopy, and you're going to end up publishing that image in a journal, you can see how a geometrical paradox gives you a much better way of expressing your findings, right, in gonioscopy. So let's see how I use my tools day in and day out. And this is an absolutely candid lecture that I'm going to share with you all as to how I am doing it day in, day out for my journey for data collection, or if it's for, practice. So you can see this is the end image of a bleb on diffuse. Below you can see the cobalt blue, and on the right hand side you can see the anterior segment imaging module that Tim beautifully was mentioning. I too have a Heidelberg with me, and then the sheep plug imaging on below. But the imaging, how it has gone processing is, this is the videographical representation of the same patient's post-trabeculectomy eye, which I am putting a slit and documenting the anterior chamber depth. And same patient looking down, I'm using a cobalt blue filter with a fluorescent dye and also documenting how it looks. And from the videographs, I am taking the photographs. This is how I sometimes do. You don't get the right photograph at one go. Sometimes it's always better, and I always feel this is one technique which is working well in my hands, especially in anterior segment. See, this is the whole video. I've attached the whole video file. You can see it's fully lengthy, it is fully going on. Again, this file is also a video file where the whole video section of the anterior segment is being utilized for the end result, where these two photographs are actually kind of human dependent. These two are slit lamp, and these three are OCT driven, right? So when you collage it, finally you get sold into the image. And AI also has a role. It starts in a smaller way. The softwares that you have in your phone, that's how you start your journey with. So this is one application, POTO. Slowly, I'll be pitching you into a lot of other applications that I am using in my day-to-day journey. So this is again a very candid representation. I am a Mac user. This is one application that I felt works well in my hands. Just saw my album. I just clicked these 4 photographs, got it into the collage version. Again, on the right-hand side also, you can see I'm just using my fingers. Pick what images I want and how I am getting it into my application. And at the end, you want to pitch it for a publication, right? Because we are here today at the end result. We did see a museum where the photographs were all published at the end. The end result of your work is always to get it out in literature, as my previous speakers were beautifully saying. So when this topic was given to me, I was just thinking, not only the photographs, but how am I getting it done? So that is why I used all these tools. You can see my daily routine. So I put a screen recorder and I thought, let me show how I do all that I do. If it's a fundus and I want the OCT to be the highlighted one, you can see how I am collaging the fundus, keeping the OCT on top, and on the right hand side you are seeing how I am getting the geometrical paradox of the gonioscopy in place. I wanted to show a very candid approach of how the end product is appeared. See, this is the gonio that you can see how unfiltered it is. At the end, you can see the geometrical paradox appearing. Again, on the left-hand side, to summarize this image, started from the smartphone where I'm marking, and I'm collaging it in templates which will give me a good end result. So this is something which works well in my hands. This is again an application which has some AI features which will really help you in your documentation journey and also your image enhancement journey as well. Because I feel in ophthalmology, where AI has a major role in ophthalmology, or these tools, gadgets, or the applications that we are talking, collage is one that we need to use, because in journals you can't get multiple images published. How many of you are publishing your images here in journal? I think all of you ophthalmologists. How many of you are getting it done in journals? Have you seen the journals charging for color manuscript charges? Yes. Yes, no. Yes. So we need to actually make sure we pitch ourselves with a lot of collages, right? We are forced to do it because of either the financial constraints or because of other issues. So that is where these collages plays a role. And you can see again aligning your images. Also, today tools are there where you can prompt and get it aligned in a very sequential manner. So this is your YAP-PA that is done. This is the gonioscopy. This is PI-PA, or rather YAP-PA, gonioscopy done, then dilating the patient. So getting your image aligned in a single level also can be given as a prompt to the tools, which I'm going to show you further. The image has to be represented nicely. Again, annotating an image. So this is the image, my dear friends. Annotating the image can also be done by prompts. What do you want the reader to see, or when you are taking a lecture like this, where do I want the attention to be? And again, most of my images and all the data is actually the data that we have come out from our institute. So I'm using the references. These are all our own images. So where do you want the concentration to be on the image by the reader? And here again, you can see another aborted chorioretinal coloboma. So you can also give prompts to the machine, the AI, but of course we need to know the clinics. You can use asterisks, colored asterisks, arrows, and then you can always put it out what you want the readers to see. I'm just trying to connect the research part with the photography part because I think we both have to align together. Why do we finally photograph? We want to document it either for teaching, we want to teach people, or we are documenting it, for counseling, or at the end result is always publications and research. We want our work to get published or featured in the best journal as possible that we just saw each and everyone, speaking along with the museum that we got to see in the break time. Right. When an image is self-explanatory, you can always avoid annotating in the prompts. But having said that, see the alignment that you always give. It has to be well centered in the collages that you are going to use. And gonioscopy, I always believe I go for the paradox. The geometrical paradox is something I'm very, very obsessed about. Even follow-up images. Again, this is another simple, trivial case of a foreign body removal. We just wanted to see how it really heals the epithelium and the stroma from a Schimflug point of view. The prompts can be given in such a way that each image has to be aligned. So you have to tell the machine that align each one of it when you make a collage. You can do it manually, but these are some simple things where we can use AI. When you're using 3 images, give it a prompt. I want it to be aligned so that the reader or the user or whatever consumer that we are going to show, be it counseling. So it tends to get aligned together. So these are things where we can save your time as an ophthalmologist if you know your data or your application that you're dealing with. Clinical part here, a foreign body removal is just going in for an epithelialization. So that's all about this picture. Right. So moving into some more advanced features in editing, which was done manually before these tools came in, but I just thought this is a very good forum to pitch this idea for people who are enthusiastic. So this is Photoshop, and this is the end image of one of my patients. So let's see how we got into this. You can see, of course, this is a Heidelberg FFA image where we are taking all these 7 or 8 images, different sections. You see how a simple Photoshop itself was used by the vessels here. So we want to create a montage view of the multiple sections of photographs that we have to make the image more visual striking. One common thing that we need is the image should be visually striking to get it out on the cover images. So all the images that you've seen outside were all cover images which were all visually striking. In FFA, you don't get visually striking unless you do a montage like this, and you would predominantly need to collage all the images. And once you do the collage, so this was done by Photoshop, but with the prompting mechanisms today, this is something you can do very, very easily. I'm just playing this once again. You can see I've made every slide video based as possible. And Photoshop is slightly tricky because you need to have some amount of idea on the tools. You have to create these layers. Each layer is very important because that gives you the hold on things. But where the clinical application comes is you can match the vessels. You can train your ophthalmological assistants or an optometrist. So how to match the vessels, and then you can always, delete the surrounding edges. So this is how you create. And this is again, as I told you, all these data are my own, and I'm going to keep it fully video based for the benefit of the neophyte audiences we have, and we can always stop me at any point in time if you have any doubts. Again, content generation in terms of image. So this is how we always start our journey, my dear friends. So when we ourselves sit to edit an image, right, we sometimes end up doing, only brightness, exposure, contrast, shadows. So these are something which are very basic, which we all do. We don't need artificial intelligence for this, but this is how we start our journey with the tools in any application that you are going to use in terms of image editing. So any image will always get enhanced when you do these sharpening, saturation, warmth, whatnot. And currently, some of my ophthalmology colleagues will be knowing I'm serving as the editor of TNOA journal, which is a 70-year-old journal. So I just thought when this talk was given to me, how can I share some more idea of how real world. I wanted to keep it absolutely very, very real and very candid. So these are some of my contributors' cover images. We have published so far 3 issues of books. I just thought, let me take you into some of the journey. So do you think this was the final image? How many of you think this was exactly shot? And this is how the image came to me when I collaged it. Anybody think this is the final image? Or you think there has been some amount of enhancement done? Yes, what do you feel? Enhancement done? Right? Arvind, what do you think? Enhancement done? Yes. So that is the role of the editor is something is what I feel is once you get the contributors images. So these are some of my application tools. So now I'm slowly taking you into advancements, Photoshop, Canva, Gemini, ChatGPT, Deep Image AI and Pixar. So these are some of the things I'm going to take you again in the next few minutes and let's see what and all we are going to deal with. So fundus images can be enhanced, OCT denoising can be done, automated segmentation can be done with the AI, heat map generation is another one we can do, educational illustration is another one we can do, and a scientific figure preparation. So these are the 6 modules that I use in my journey. So this is the next book that is due to be published. I'm sharing it in Zoom. So if it's keynote directly related, I think it would have been better. But anyway, you can see how the pre and the post of real editing. So we haven't done any tampering to the image, but the images have actually been enhanced. When it features on the cover, you can see that this is something I strongly believe in, and I hope you are able to appreciate the differences between before and after, especially the fundus and the anterior segment here, which has had some amount of filters which has been removed. Again, this is another image which got featured in the DNOA cover last issue. Especially, I would want you to focus on this image here on the bottom. If you're able to see the final output that this image has actually been converted, small amount of zooming has been done, these reflections have been removed, and then you can see that special emphasis is given to this area to make it look like a volcano, which already is. It's a neovascular glaucoma with a peripheral anterior syndicate, which is extending up to the lens, and you can see that how imaging can actually be enhanced. So yeah, so there is some amount of pixelation because of I'm sharing it over Zoom, but I still feel you can appreciate it to some extent. And all the other 3 images also in the OCT, especially if you see the green color boxes have been removed. You can see that the box in this has been removed. There is no box. So these are some prompts you can give to the application and remove it. I didn't want the green box to be on the cover, so we choose to remove it. Again, this is another image. This is again April, May, June issue, where you can see this is unedited and this is the edited one. So it looks the same, but with inquisitiveness, if you are able to pick up, you can see that some of the reflections, especially here, the edges of the reflections here, you can see that is not here. It makes the pupil appear slightly more darker. On a cover, these are some small blemishes. It gives you much depth. So this is where the prompts come in, where you get a striking image. And we're just showing this to Dr. Arvind, and he was asking me, this image looks very visually striking, and that's when I added this, and I wanted to show you guys. Even the flecked retina here, you can see before and after. So the small tips that we are going to see today on artificial intelligence application on photography is going to, I think, benefit a lot of not only ophthalmologists. I can see a very, very diverse crowd over there. Right. So this is a video of the modules I was just showing. How do you put it? How do you keep it? So, and how do you finally archive it in the way that you just saw? So you can see that when you see it in a videographical way, you can appreciate the small differences that the image undergoes into to finally become what it finally becomes. You can see the small amount of course correction that is being done. I'm just going back a bit. So this is how it is. You can see I'm just forwarding it quickly for your brain to pick up the small correction that is being done, right? So that actually gives you the final crispness or the final endpoint. So this is the final endpoint, my dear friends. But you can see that to reach this endpoint, it has to undergo so many things. I'm just going again back a bit. So now you can see the fine differences that is being made to make it from here to here. So this is the things that I wanted to show you, and again I'm keeping it video based. So this is again in Remini, one of the prompts that I wanted to show you in Remini, a synthesis scintillon scenario where you take a good fundus image and you can see that small enhancements that you do, even if it is going to be for your collection that you're going to have. This is before and after again, which I wanted to show you. So these applications are now coming in, and there is a fine line between enhancing and tampering it. I don't advocate tampering, but these are some small enhancements which gives you a lot of visual credibility, and also you can have it with you in your own virtual museum in your laptop. Again, polishing details. So you can see Chat GPT, what am I polishing in the specular microscopy image? So I'm just giving it a prompt, to add a final touch in that specular microscopy image. Can we just polish this image a little bit more so that things get a bit enhanced? So that is something you can always give a prompt for specular microscopy. And this is a very one of my personal favorites, I should say. You can see it is Canva. This is a Eidon confocal fundus camera. I change the black background to white for you, giving it a pre-op and a post-op. So Eidon always gives you a black background, but I always felt if you can make it white background, it gives you more striking. The image looks more striking with a better visual representation. Because with the black, I always felt it's not that much giving up. So ask anything to Canva. I'm just asking it to change the black background to a white background. Previously, I used to sit and do it in Photoshop, but now a simple background change and the image enhancement. So it has now replied. What has it replied? Perfect. I have. Let me just go back to the frame. Pause it here. Yeah. It has replied. Perfect. I've changed the black background to white. The medical fundus images now have a clean white background, preserving all the important details. So when you choose your journals, when you go for publications, these are some small tips and tricks which are very important. Another one, prompt image. So let's see how we are doing in this. As I told you, when it came into the market, the images were more true color. It never had that reddish hue that you expect with the fundus. So what am I? This is how it is looking. Pre-edit, enhance this retinal fundus photograph by improving the contrast, reducing the noise, highlighting the microaneurysms and hemorrhages while preserving the clinical accuracy. So the prompt that you are going to give. So I'm just slowly taking you to an advanced world, my dear friends. Now the prompt that you give is absolute importance here. So the clinical accuracy has to be preserved. So the right message I want you to take home out of this lecture: never tamper the clinical accuracy. It's unethical as well. When you move into the fine line of AI, make sure the prompt that you are giving is absolutely important. And now let's see this image, how it ends. So the pre-edited image is on the right-hand side top. It's smaller, but you can definitely understand how it is. The post-edited image, the aneurysms are well seen, and the images are well seen because you have removed, or it's more of polishing the image. Keeping this in mind. So let's see some more scenarios, right? Again, one of my very favorite prompts: generation content with prompt image. Let's see the prompt here. I'm just going to pause it here. Scientific figure preparation. Convert this clinical image into a publication ready figure with annotations, scale bars, labels, and consistent formatting. So now, once you give a prompt, and you need to sometimes customize the AI module towards yourself also with some human in the loop. Teaching the machine more will always help you to get more out of the machine. So see the end result. I've already coded this customized to my clinical acumen. So the end result comes to you. White field image showing an inferior choroidal mass or a chororetinal mass, course, it's a different one. And silicone oil tamponade, something like that comes you with a prompt, but ideally this is clinically still wrong. This is not a silicone oil bubble, or this is not a remnant. It is totally a different entity. But this is how it starts your journey with. Whatever the machine can, it gives you. See, it gives you, this is the disk. Few points are right, few points are wrong. But you start it like this and you train the machine, okay, this is wrong. I want you to replace this with this. It's a Colombo. So I want you to replace this with this. This is not it is not a mass, it's a co-retinal coloboma. So you now teach the machine, can you remove this as a mass and put it as a co-retinal coloboma? So you learn. So that's how you teach the machine. And at the end, what do you get out of it is you get a good image with lot of markings like this, which we used to do previously and save a lot of time when you go into your publication journey. So yeah, again, this is again one of the anterior segment images where I'm just forwarding it. Only when you forward these, you will know what it was and what it is actually becoming, because the pre and the post edit with lot of layers or lot of prompts that you give, how does it really enhance itself? So this is the end image of it. Let's see few more practical tips. Again, this is another image, a deep image tool that I'm using here. Let's see the processing, before and after processing. So the image is slightly blurry, or it has a lot of layering to it. So before and after processing, so this is before, this is after. This is before, this is after. Even sometimes when there is a blurred imaging feature, you can always, enhance it. This application that I use is deep image, and this also works well in my hands, and to get the image up and running. Again, to slightly move into advanced features, especially people who are traveling, to international competitions. We have a lot of After Effect category competitions, especially the Ophthalmic Imaging Society in ASCR as an American academy. They have a special category for After Effects. They want to test your digital evaluation acumen. They have this separate category seen only in these 2-3 competitions in ASCRS as well as in AO, which I started attending after getting inspired from Venkatesh sir, the special After Effects and the AI category competitions. So again, this is a deep dream generator that I'm using. These are all completely scenarios where I'm creating everything on from with AI. This is generative AI. This is not an AI which I showed you in clinics. So this is how you start using these generators. You are typing that you want to have a ocean scene inside the eye. You type whatever you want to, it gives you its own logo, it gives you its own prompt. So why I'm showing you this is because in competitions like those, I'll show you some of my own images which I edited. So see this image, for example, my dear friends. So I do a lot of augmented reality work and holographic modules in eye. So one of my award-winning images in ASCR is this image. Would you believe this? I say this was one of my award-winning images. So let me show you how I did this image. A lot of holograms that I had in different filters, color filters, autofluorescence. This is a neovascularization. That is a glaucomatous retinitis pigmentosa in autofluorescence and infrared. So see how I am getting the prompts ready. So what I do is I am just keeping this as fruits, and the root is coming in as a fundus with a diabetic retinopathy in a monochromatic spectralis OCT image, where you can see that a simple flower pot, or rather a simple roots with no flowers, just the leaves. You can see how the image is being made with a creativity. If you're going for a creativity contest in a lot of, I told the OPS Society, Ophthalmology Photographing Society context, you can see how much of fruits or rather the eyeballs, and then you are changing the whole background, and this is the end image, right? So creative competitions, when you go, of course, this is not for research. So this is the final image, and I'm just going back. So this is how the image was. This is how the image is. So a very simple module, but it makes a lot of difference. Again, this is a tractional retinal detachment where you can see I've made a few holes in it voluntarily. And what did I do? for that particular event, which I pitched at ASCRS OPS event, where you can see genuinely I've made few openings here. Let's see how this image comes out. This is again one of my images in the after effect category, where you can see I'm pitching Spider-Man inside. So tractional retinal detachment is how it looks. So this got featured in ACRS 2024. You can see again I'm going back, keeping Spider-Man in. He's pulling all the retinal detachments. Then slowly I'm bringing the background, I'm bringing the picture of New York or an anime, and then again transparency, increase, reduce. This is the end result. So is the fundus there? Yes, the fundus is still there. The optic nerve is here. The tractions are still here. But you give it a more different soul. And today with a lot of AI tools, is this possible by everybody? Yes, this is very, very much possible by all. Again, another image of mine. This was one of my FEVR patients where you can see the optic disc. Clinically, it looked like this. What did we do it? I just added some more fire to the tail and made it look like a comet. So these are some of the other things that you can really do. Creative level, it has no limits, my dear friends. Coming to this specific image, this was one of my images which won the 500 rupee grant in APAO, Asia Pacific Academy of Ophthalmology. This is again a retinal detachment image. I just sliced open the retina, laid it flat, and then added these layers. This was again in the upper category. This made it look like an electrifying tights with an aura serrata appearance. So these are things that you can actually enhance, and ophthalmological photography competitions really appreciate and enhance these kind of creativity, where just from an ordinary beach kind of a thing, you lay down the retina, you crack open the eye, like cutting it open, laying it flat like an electrifying tights on a beach. So this was what fetched me my Asia Pacific award last year. And also forums like APAO, ASCRS, AAO really encourage these in your competitions, and it gives you a lot of ability to pitch yourself as an innovative person or an innovative mindset. So again, this is some of my other images which I'll be showing it to you. Why we do what we do is it really gives you a lot of credibility to your work, when you land your images into these kind of competitions. And I'm going to take you forward quickly through other images because time is less. I would absolutely love to share how I did each and every image. Every image doesn't need editing, but you can see that some images are definitely edited, be it the holograms that my assistant is holding here, or even if you can see few amounts of specular microscopy on the right hand side, or even the Easter service when we took this photograph, it was not exactly the same, but we had to do some amount of polishing. So these are some of my ASCRS 2022 images. These are some of my ASCRS 2023 award winning images where this is one particular image I take immense pride in actually. What is this image? Can anybody make sense of this image here? It's an iris, right? So this is actually the eye. Draw a circle. This is an eye. This is a pupil. So I took my own patient's anterior segment top on view and converted it into a flower, giving it some small trimming, which we do in our craft, right? We fold the paper and just give it some cut. This was made like a flower. Of course, anybody wants to take a guess what is this? This is not an edited image. It's an anterior segment imaging module photograph. Anybody? Clinical diagnosis? We all get this when we do SACS. DM detachment, correct. Decimal membrane detachment. This is a simple decimal membrane detachment taken in the anterior segment imaging module of Spectralis Heidelberg 1. What is this image? Anybody else? What is this image? Glaucoma. Anybody wants to take a wild guess? It's a normal image. It's just a normal image. FFA, can you see the flow? FFA, it's technically fully not, it's an FFA, normal image. So this is a monochromatic spectralis normal image, which gave me a feel of an embryo. Can you feel that comparison of an embryo? So, these are just there, my dear friends. You don't need to search for ideas. I didn't install the color filter in my spectralis Prabhu at that time. So I just ended up just using the monochromatic image and I just pitched it at 2023 ACRS. So these were some of my images in ACRS 2023. These are some of my images in ACRS 2024. So I take pride and inspiration from Venkatesh sir, who keeps motivating all of us to attend these kind of competitions in especially ACRS. And these are some of my other images in other competitions, which I'm not going into detail, but I thought I'll show you guys all this. If you want to stop me and say, how did you end up getting what you did at this image, I'll be happy to help you out. I'll be happy to share how I did this. So these are all my own images. So this is the thing, my dear friends. The images are very important for ophthalmologists because it speaks a lot. It speaks 1,000 words. Again, this is one image of a Sturge Weber patient, where this one solitary vessel alone was very, very, very prominent. You tell a narrative when you talk in terms of images. When you walk through the museum that is outside, you tell a narrative. There is a story to it that you actually say, right? That is what matters. And this image of the bottle, though it had a heart, the image was absolutely blurred. We had to use the deep image application to get it crisp and pitch it and then get it out into the literature or get it out into a photography competition. Again, this is another few data sets, and you never know where you get your images, but make sure to document it. Without documenting your data, you can't move forward, whatever it is. In ophthalmology, documentation is very, very important. And here, I want to show you guys this one particular image of surgical image of mine. So this case, I was very happy because I got a very circular axis. One of my earlier days, 2019, when I was just starting my practice at Trichy. But ironically, my two side ports were a bit weak. So what happened is both the irises were going on either side of the side port, and it was giving an eye within an eye feeling, right? So I just stopped, I just documented it, and then went back to putting the iris in and then keeping the IOL. So always documentation is the key. Stop and document it, and these are some of my award-winning images, which ended up featuring on the cover. So this is my IJO cover. That was my ophthalmology glaucoma, where we had an accent-filled Rieger syndrome. And this is one of the healed RDs which got featured on Kerala Journal. Again, these are some of the other cover images which got to feature. All the data that I just showed you, my dear friends. IJO case reports on the photoshopped FFA module of imaging that we did, that ended up featuring again last year when Dr. Jayantan was the editor of TJOSR. And many more. The DM strip got itself chance to feature on the Kerala Journal. So I think you'll strike from global, grassroots to global. So that's the whole idea about why you do what you do. Because a picture can speak 1,000 words. Now we are living in an era where we need to know our tools. A picture alone doesn't really, get yourself there. Yes, a good photograph is very, very important, but a good photograph, well done, and you know your craft, not only your cinematography. A movie needs both the cinematographer and the editor, along with the director. That's how you get the product delivered well. So when you start what you do, you'll be on a roll. And these are some of my PubMed indexed publications. Each image that I'm pitching, see how I am pitching it. See the correctopia, how you are pitching it. You have to give a prompt in such a way that the pupil should be seen that it is being pulled towards the extreme, the nasal side. So when you're pitching it, see this, you're cutting it, the pupil is already gone the other side, and you're showing the same syndicate matched with the ASOCT. So that gives you a story, that gives you a narrative, that when you pitch it like this, the concepts is also understood. The readers understand it better, as well as you pitch your work in a better way. Let's see a few other. These are some of the additive images of the same. Again, this is another publication of mine, IGO PubMed. Tourette-Zavalia syndrome. When I placed an eye stent, the pupil just was not going down because of a spike in IOP. So how you are going to pitch yourself in ophthalmology literature is, it's going to be because of a lot of images and the data that you are going to say. What is the practical application of why we are discussing what we are discussing? Again, another scenario 3, how these all images make itself into literature. Our center is a training center, so when we do training, we have a lot of flap related complications. This was one of the flap tears that you can see here, yellow arrow, which is being managed. This was during the COVID time where we are using Gore-Tex in one of the few cases for the fistula that was developing, where we try to close it. But see how depth you need to collect or monitor the fistula, how the fistula anterior segment, how the AC is shallow or deeper because you don't want hypertony. See the fibrous reaction that is taking place, as Professor Tim was also telling about the anterior segment imaging module, how I documented my fistula. Because as a glaucomatologist, this was how my fistula was looking. Can you see the clear area on month 1? But on 1 year later, the fistulous area started going in for cicatrization. So now it gives me better comfort that yes, this patient, that fistula is healing and it will not burst like a bubble, right? So again, this is a very simple one, a striate keratopathy, where how the SK settles itself. Everybody has SKs, so how it settles itself on OCT as well as in sheen plug imaging. You can document any number of things. This is again granulomatous uveitis. I always keep telling geometrical paradox in my gonioscopy is something I absolutely do it, and then you can always measure each and every keratic precipitates. You can analyze it, and these are some of the measurement tools that we have used to measure and map each and every K piece. Again, this is to add on to multiple things. One of the publications from our institute, again, anterior capsular phimosis. How did we use a micro MBR plate to just nick it out and open it out? Again, now the crack of a Hoya lens when an Alcon cartridge was used to inject it. So small things daily in your practice, when it happens, document it, keep documenting it. Again, this is again congenital lamellar cataract. This is a phenytoin-induced mydriatic reaction which caused a bilateral acute angle closure attack. But as I keep telling, I'm not going into the clinical or the research part of it, focusing only on the photography. Every photo should have a script. Every photo should have a screenplay, and the way you are pitching it at the end should have a narrative. These are some n number of publications from our center where you can see, I'm not going into the detail, every frame has a scenario, has a script, and the prompts that you are going to give with the current scenario, where you need an arrow, where you need an asterisk, each and everything should be having a prompt. And then even the collage that you're going to use for a prompt, it should have a script. So some of the images, again, everything at the end gets published from our center, which again I learned from Dr. Venkatesh sir, who keeps motivating us, keeps inspiring us, getting it out into the data. Multiple scenarios. I just stop here again for a pseudo blur. How do you pitch yourself? Anterior segment photograph, anterior segment slit lamp imaging. Then you have the anterior segment imaging module of the spectralis, and then the see the where you need to prompt an asterisk, where you need to prompt an arrow, how is the septae and the loci of the blood. Everything has to be marked well. We have to teach the machine also. The machine doesn't come with instant answers. We have to sit with the machine with these applications and teach it so that we get these, easily done, and saves a lot of human time. Again, this is one of the microspirophagia cases. I always feel the most important prompt is to align everything together in a very nice way so that the images are collaged in a proper manner. Again, one of the last few scenarios, a cough syrup induced bilateral acute angle closure attack. You can see the image is again prompted and collaged in the right way. That's more important, right? And this is the last, one of my latest publications on mix, how the angle modifies itself after different mix. This is a normal angle, this is a KDP one, this is a bang angle, this is a suture gad. That is why I have used all the 4 segments, whereas in bang and KDP, I'm going to do it only in 1 segment, suture gad. I stent inject, where 2 I-stent implants are given. So in that image alone, what do you see? Not only a collage, but I've used a magnifier. Why I've used a magnifier? Because I want the viewers that the arrow alone is not sufficient. I wanted an extra magnifier to make them see the exact spot where I wanted them to see. And this is the ASOCT image of the same, or rather anterior imaging of the same. Again, I've used a magnifier. So that tells the story. Does an image tell a story? Absolutely yes. If the magnifier is not here, just the arrow, still the image would be conveyed correctly. But prompting a magnifier for the area where I want the arrow gives more clinical acumen that this is the normal angle. In KDB, there is complete excision of the meshwork, there is no remnant. Whereas in band, bent ab interno needle goniectomy, there is some remnant of the trabecular meshwork. Whereas in suture gad, there is a bird beak configuration, angle remodulates itself. Because we are not excising the angle, we are only tearing the angle. So this narrative, in I-stent and I-stent inject, it's a back shot. So this comes with lot of the narrative that I'm setting here. I want the viewers or the readers to get the right message. That is why today we are talking about all these today. We need to set the prompt at the right plane. And of course, again, we were the first to come out with the Y sign and the bird beak shaped configuration with few name signs in the post-mix era. And just coming down to few more, additive images of the After Effects category to lighten the, we were going too much into academics as well. So this was one of my recent edits I was doing, Dr. Strange. See how you can, a few more images that I'm getting it ready for the next AACRS Congress, After Effect category. You can do lot of things in these prompts, lot of things, video of a human eye with logos reflecting on it, deep dream generator. So start like this, my dear friends. It's a very simple start. It's not very difficult. Today, application driven ophthalmology is taking over, and we all are using ChatGPT. None of us here can't say that we are not using ChatGPT. No, it has become kind of an order of the day, like WhatsApp and YouTube, and you can do a lot of things. And I think ophthalmologists out here who attended AAOS 2022 in Mumbai, this was the cover image on the AAOS 2022. I got this idea from one of the logos from an IPL team called Mumbai Indians. How many knows Mumbai Indians here? Have you guys seen the logo of Mumbai Indians? This is how it looks, right? The logo of Mumbai Indians team. So how did I do this image here is, this is again one of the very, very nice ones. You can always pitch yourself into these kind of imaging modules for our AOS forums also. Simple patient's eye from the side angle view with illumination from the front was taken. The real eye, that was not AI, this is human intelligence, but the drawing was done digitally. The same real eye was horizontally put, and you can see that these edges were removed because it had some glare. See, I'm removing the glares here. Now what am I going to do? I'm going to spin this image. So when I spin this image, I'm going to get the data. What data am I going to get? Right, I'm making the pupil more black. I made the pupil more black, and now see what am I doing? I'm blurring the edges of the image, or I'm rather spinning this image with a kind of a smudging tool, and that gives you a creative approach to a cover image that we all would want to do. Back in the day, AO has always featured a creative cover image. I'm adding some stars, adding some clusters like a Milky Way, and then that's it. So the image is finally ready to be processed. And it featured on the cover of AO's program book. So I think sky is the limit. We can always keep doing, and I always keep doing this. There are two approaches. One is you always have to be ethical. You need to know where you are pitching it. If the competition or a research forum says don't edit it, do not do it. If there is a forum specifically for this, go for it. This is one of my recent images that got featured in the World Glaucoma Congress last year, and uh, I made a prompt out of it as well. Make it cartoon. Why not? Why not make it cartoon? So a lot of things are there. When I posted this on social media with my image, we all are doing Ghibli. That was an era when Ghibli was there, and of course, I'll skip the last part of the topic for want of time. I think AI in ophthalmic imaging diagnosis is not the thing for today, right? Few points you want me to touch? Perfect. So I think this comes to an end of photography. I'll just take another minute or two, and I'll not stand in between you and lunch, maybe 2 more minutes. So as of now, whatever we saw was imaging photographs, how we are pitching the photograph, how we are using it for teaching, learning, counseling, then also publishing and getting it out into various competitions. But again, ophthalmology, these are some of my original work in ophthalmology on AI as well, which I have published extensively. We are also teaching these images to interpret findings. I think Professor Tim also was telling in his talk as to where is the cup, where is the disc, where is the peripapilar atrophy, where is the RNFL defect. And we want the tools to diagnose the condition along with the intrinsic findings. So not only I want it to be diagnosed as glaucoma, why it has been diagnosed as glaucoma. Not only I want it to predict. So the more I teach the machine, the more the machine gives me, this is diabetic retinopathy, why this is mild. So this is a mild one, this is a moderate one. I'm just so this is a mild one, this is a moderate one, severe NPDR, and then this is a proliferative diabetic retinopathy. Why it is PDR? That also can be done. It gives you diagnostic cues. The more you annotate and the more you train, you can have your own AI algorithm for yourself where you can actually get these inputs also. This is all predictions. And to touch a few points, one is the human in the loop. These are all there on literature where I have extensively, me and my team have published it. We have worked extensively on angle AI, UBM AI, anterior AI, AS OCT, and whatnot. So finally, why we do it in terms of diagnostics is when you create your own AI, you want to have an offline smartphone application tool that if you take this image and put it into the app, again, this is just a 30-second scenario. In my laptop or in my phone, you can see I'm taking this anterior image and putting it into here, dragging and dropping it. Soon as I put it, within instantaneous chat time, I'm getting the protractor mapped. So where is what? Where is the trabecular measure? Where is the scleral spur? What is the predicted angle? Is it open or closed? So that is what we want to do at the community level. Why do we talk about AI in terms of diagnostics is even an MLOP should be able to do it. We need to get it out in a smartphone, and it should be a multimodal approach in terms of glaucoma that I am part of. I am a glaucomatologist. Some of my works are predominantly anterior segment related mostly. So this is again one of the AI tools that we did. This is a bimodal AI that we have recently published on OCT, where we cracked an algorithm for visual marker and digital marker. So multiple things can be done, multiple things. So I just wanted everything to be my own data, my own original work to the people that I'm sharing it today. I always believe the end point is smartphone application. Whatever innovations that we do today, whatever it is, it has to serve the end user. And in a country like India, we need to make sure that it is in the smartphone at the end of the day so that it reaches out to the rural population and we are able to, whatever imaging that we do at the community level is being immediately put into the application and validated. And you can do, sky is the limit. You can keep moving with so much more. And always keeping in mind, whatever AI tool that we use, it has to grow like a baby. It can't just like that, whatever I showed today has grown to such extent that it works well in my hands. So that's why I put a huge disclaimer. This is just one method and this is not the only method. So for me, it is a journey that I traversed since I completed my PG 2017. I had the inquisitiveness to these schools. It's been a 9-year or a decade of journey in these schools. It has to start like this and then go. Maybe I would say I'm somewhere here or here. So you need to make sure that you can't put the blame on the AI, saying that that prompt did not work well. Always keeping in mind that whatever you get out, be it literature, publication, or diagnostics. When it comes into diagnostics, medical legal implication also plays a role. That the AI will not take the blame in court of law. It's the clinician who signs will be held responsible. So that message is something we need to take it in mind. And with blockchain technology that is coming up, a lot of things that is going on, I think sky is the limit. And I think thanks a lot to each one of you once again for your patience. I think I took an hour. I told Arvind I'll be finishing in 30 minutes. I told sorry, Prabhu. And of course, this is Prabhu's photo we just took. And thank you, Prabhu, for the opportunity to speak amongst such legends. Dr. Tim, of course, Deepak sir is here, Vignesh sir is here, Arvind, Venkatesh sir is here. So thank you for the opportunity. And again, I wish Venkatesh sir was here to see this photo. Again, dear friends, this is not A. You can send it to sir. Sir, I saw a picture of you that I didn't know you vibe like this because I was, Venkatesh sir was a terror for all of us. I was his PG. I was doing my PG at MGM and I always used to fear sir. This was a photo that me and sir took last year. I wish this reaches sir. And you can always contact me on Instagram, Prasanna V Ramesh, my mail ID, my phone number. I'll be happy to address all your doubts. Thank you. Thank you.